Complications of pregnancy. Some common early pregnancy complications are: 1. Ectopic pregnancy, a condition where the fertilized egg implants outside your uterus, usually in your fallopian tube. The egg can't develop outside your uterus, and you'll need surgery or medication to remove the ectopic tissue. To miscarriage. Miscarriage is the loss of a pregnancy in the first 20 weeks. About 10% to 20% of pregnancies end in miscarriage. More than 80% of miscarriages happen in the first trimester. 3. Hyperemesis gravidarum. HG is severe and persistent vomiting during pregnancy. It can lead to dehydration or losing too much weight. For congenital disorders, if your healthcare provider suspects the fetus has a health issue or congenital disease, you're at higher risk for complications during pregnancy. This may mean you need additional monitoring or your baby needs special care at birth. Some of the common complications in the last half of pregnancy include: 1. Preeclampsia. Preeclampsia is a blood pressure problem that develops during the second half of pregnancy or up to 6 weeks after you deliver. About 10% of women will develop this during pregnancy. It's more common in women with high blood pressure before pregnancy. After your baby is born, the complication will start to go away. 2. Gestational diabetes. This happens when your pregnancy hormones make it hard for your metabolism to keep your blood sugar levels stable. You'll have a glucose screening to detect diabetes during your pregnancy. Most women can keep their blood sugar levels under control with diet and exercise, but some need medication. The condition usually resolves once your baby is born. 3. Preterm labor. Preterm labor is when you go into labor before 37 weeks of pregnancy. This can cause your baby to be born at a low birth weight or with underdeveloped organs. For infections, many viral and bacterial infections can complicate a pregnancy. These include urinary tract infections, yeast infection, group B strep, and bacterial vaginosis. Sexually transmitted infections can also cause pregnancy complications. Certain infections can be passed to the fetus during pregnancy, like torch infections. 5. Vaginal bleeding. Heavy or excessive bleeding during pregnancy requires immediate care. Contact your provider if you notice bleeding at any time during pregnancy. 6. Placenta previa or placenta accreta. Problems with the placenta can interfere with pregnancy, labor, and delivery. 7. Placental abruption. Occurs when the placenta separates from the inner wall of the uterus before birth. Placental abruption can deprive the baby of oxygen and nutrients and cause heavy bleeding in the mother. 8. Oligohydramnios or low amniotic fluid. Low amniotic fluid means the fetus is surrounded by less amniotic fluid than it should have for its age. This increases your risk for premature birth. 9. Polyhydramnios or too much amniotic fluid means the fetus is surrounded by more amniotic fluid than it should have for its age. 10. Depression and anxiety. Extreme sadness or worry during pregnancy can affect fetal development. Contact your provider right away if you have thoughts of harming the fetus or yourself. 11. Anemia. Anemia is when you don't have enough red blood cells to carry oxygen throughout your body. It makes you feel tired and weak. Okay, it's common in pregnancy because you need more red blood cells to carry oxygen to the fetus. Iron deficiency is a common cause of anemia. You can prevent iron deficiency by taking supplements or eating more iron-rich foods. These are some of the more common complications of pregnancy, but there are many others. Talk to your pregnancy care provider about how you're feeling at your prenatal appointments. Having honest conversations about your symptoms helps them detect potential problems. If you do experience a complication of pregnancy, your pregnancy care provider may recommend a maternal fetal medicine specialist. Thank you.